Welcome to the Humble Hoof Podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 20% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and the TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 20% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. If you're struggling with a tough rehab case, the Humble Hoof is excited to now offer truck-in services and rehabilitation boarding at our facility in Amesbury, Massachusetts. Check out thehumblehoof.com for more information. Dr. Craig Lesser has popped up on my radar a few times as a handful of his case studies have come across my newsfeed on a few different platforms. I've been especially interested in his approaches to keratomas and chronic abscessing, as this is a specialty of his. Dr. Lesser works at Rood and Riddle as a vet podiatrist there. And if anybody has listened to the podcast for any amount of time, you've heard a handful of Rood and Riddle farriers and podiatrists on various episodes and know that they do some pretty interesting work. I reached out to Dr. Lesser to see if he'd be willing to chat with me, and he agreed. So why don't you start by telling us a little bit about how you became interested in podiatry in the first place?
Yeah, I became interested in podiatry in vet school. I had a classmate who was a farrier before vet school, and he needed a new apprentice. And, he was offering a pretty decent paycheck, and I thought it was going to be easy money. So I did an apprenticeship with him. And, I'd been a professional college student for 5 years at that point. So I was so out of shape, it took me 3 tries to trim a foot before I was able to get it completely trimmed. And I realized I was in kind of a lot of trouble. But I stuck through it and finished up the apprenticeship and planned to go back into sport horse. I knew lameness came from the foot, and that's the route I decided to go. But when I was doing my internship, I got kind of frustrated because, we were constantly injecting coffin joints, and we had all these laminized horses that we were addressing, but I felt like there was more we could do and got a little frustrated with that. So I was offered a fellowship down at Rood and Riddle in the podiatry department. I figured I would go learn some more about the foot and then come back into the sport horse world and then apply that there. Then I came down to Rood and Riddle, and it kind of sucked me in, and I've been fascinated ever since about all the things we can do with the foot that can affect the horse, both from a sport horse perspective, but also from a lameness perspective.
Yeah, and actually I had the chance to go down to Rood and Riddle in October of 2020, and I was super impressed with the department down there. I think it's really awesome what you guys are able to offer and do there. So that's part of the reason why I wanted to reach out to you, because of some of the things that I've heard that you're really experienced in. The two that I've heard that you do a really good job with are chronic abscessing and keratomas. And I'm sure that you do a great job with many other things too. But I'd love to chat about those, because I actually don't have podcast episodes about at least about keratomas yet, or really diving more deep into chronic abscessing. So first, for those who may not know, can you tell us what a keratoma actually is?
So keratoma is just a benign mass of keratin within the hoof, is simply what it is. It grows slowly and causes pressure necrosis. So as it grows, it pushes up against the bone, and little bits of the bone dies, and that'll cause abscessing. So it's one of the many things that we start worrying about when a horse has chronic abscesses that possibly might have a keratoma.
And do we know what causes the keratoma to form in the first place?
Honestly, we don't. And it's one of the reasons why I stuck with podiatry. There's a lot of unknowns still.
Yeah. All right. So let's say, I know that you just mentioned chronic abscessing, but, if you're coming to a podiatry case, are there other symptoms that would make you suspect a keratoma?
Yeah, depending on the location of the keratoma, sometimes you can see a deviation in the sole. That's usually once they're a little bit bigger that you start seeing that. But truly, the most common reason why we see them is because of chronic abscesses. With Some cases we're starting to do MRIs for pre-purchase exams. Some of those cases are picking them up even on pre-purchase exams with MRIs, or for, just incidentally for MRIs otherwise.
And, so there are keratomas that don't cause any issue?
Well, while they're small, they're not causing an issue. But if they grow to the point that they are causing pressure on the bone and then death of the bone, that can cause some issue. But no, we do see a decent number that aren't causing issue. We just sort of find them as incidental. And because the surgery is fairly invasive, we go ahead and leave them in there until they become a problem.
All right, yeah. And, I get radiographs sent to me from vets and clients, even if they just get baseline radiographs. And I'll sometimes see a crena or an area of bone loss that makes me a little bit suspicious that something else might be going on. So if you are looking at some diagnostics, how would you tell the difference between osteolytic aspects of the coffin bone due to chronic abscessing or an infection or osteomyelitis versus keratoma?
Yeah, it can be really tough, especially if they're very much so on midline, because on midline we do have the carina there. So there's a few ways to look at it. The last one I had directly on midline, I had previous radiographs of, and I was able to see that it had grown significantly in the past year. So that was a pretty obvious reason we have it. The other thing we can do is we can take some standing obliques for the ones that are conical, and you can actually see the indentation in the bone going up the hoof wall on these. And that really helps to determine what they are based on their shape. They're also a very perfectly smooth surface versus a lot of our more infections aren't as smooth and they're more of a mottled look to them.
Okay, yeah. And so you mentioned surgery to remove them, but you said that you wait until they're causing an issue. What's that kind of, line between, okay, we're going to leave it and wait and see, and okay, now we're going to do the surgery to remove the keratoma?
Yeah, for me, it's usually abscesses. If we are lameness or abscesses. So there's two types of keratomas. There's spherical and conical. This spherical ones, they're little pearls that you can just sort of pluck out of there. But depending on the size of the keratoma, it can be a fairly large hole in the wall, anywhere from the size of a quarter up to probably 2 or 3 times that. And then our conical ones, we actually have to resect from the coronary band all the way down to the ground surface. So it'll be a full year until that horse is back to normal. So I usually use abscesses or lameness as one of my big indicators of it's time to remove these.
Okay. And yeah, you mentioned the recovery. So what is that? Well, what are you doing for support for the hoof as that hoof is recovering from the surgery?
Yeah, so for me, the most common ones that I see are the conical ones coming from the coronary band. On those, we remove the whole section of hoof wall from the coronary band down, and then I go ahead and I attach some plates across that act as an artificial wall and stabilize it. The number one complication I see for these is if it's not stabilized properly and it starts to collapse on itself, because we're basically forming a big hoof crack. So making sure it's nice and stable is important. And then we're also debriding all of this soft tissue. So we need to make sure it's nice and packed tightly. There's lots of good antiseptic in there and preventing any proud flesh from forming as it cornifies. So as the tissue itself just forms that outer hardened layer.
And what is the success rate in these cases? Is it usually pretty successful?
Yeah, no, it's usually very successful. I've recently had my first one that it recurred, and that was a pretty complicated one. But usually we're pretty darn successful with these. As long as you can get the entire lesion, usually have great success on these.
All right. And obviously for the farriers listening, this is vet territory, right? This is a surgery that would have to go to a vet hospital.
Yeah, this is pretty invasive here. So
yeah. All right. Well, so is there anything that can be done to reduce the growth of the keratoma? If you find a keratoma, is it just inevitable that it's going to continue to grow?
So yes and no. It is a chronic progressive growth. However, I have done some chemotherapeutics on them at surgery to prevent regrowth, also some lasering and some other things. I have not had any great experience with using that alone, but I would think theoretically there could be some possibility of that slowing growth short term, but I personally don't have any experience with it. But it's a very interesting concept.
Yeah. And so it's not something where, do you think it's a pressure thing? Would leverage reduction help in those cases, or is that not really what's the cause of the growth?
I definitely do leverage reduction on those ones that aren't causing issue, but we found incidentally, especially if they're in the toe region. And I think part of that is to prevent any excess stress on the bone and lamina in that region, because the lamina is also compromised. But I honestly don't know if that has much to do with its growth. Unfortunately, keratomas are one of the reasons why I decided to do podiatry, is because we don't know a lot about them. And they're fascinating and frustrating all at once.
Yeah. Yeah. And luckily, I mean, I haven't had, well, I'm sure that I've worked on hooves that have had keratomas, but I haven't had a case that's needed to go in for surgery or had issues to that point. But it's really cool that you've been able to work on so many of them and give us these kind of answers.
And that's the cool part about what I do now, is since this is all that I do, I get to see a lot of these, because, a lot of these diseases we're talking about, most veterinarians and most farriers might see once in their career. They're very rare, and a lot of times they do get passed over, because in vet school we had one slide on what a keratoma was, and it's not something that's usually on the forefront of our mind when we're seeing chronic abscesses. So it's actually a fairly rare thing that I just lucky enough to live somewhere that we get to see all the weird stuff.
Yeah. Obviously, chronic abscessing doesn't just come from keratomas. So what are other causes that you see for chronic abscessing in a hoof?
Yeah. So, I guess just to start with, if your horse has multiple abscesses, it doesn't hurt to get a radiograph. So I'd encourage you, if your horse has had multiple abscesses in a foot in the course of a year, especially if it's in the course of a few months, to get a few radiographs of that foot and see what's there. Keratomas are there, but they're not as common as some other things. One of the most common things we see here in Kentucky is septic pedal osteitis, so infection of the coffin bone itself. And then past that, you can also have something called a pedal sequestrum. And that's when a little piece of the coffin bone itself dies and falls off, and the body starts attacking it like it's a foreign object. And we can have things like foreign objects and other causes from abscess, but sometimes those are a little bit harder to see on X-ray, especially if they're made of wood, because wood doesn't show up on X-ray.
Right. And so what's your approach to those kind of cases?
I don't see a lot of foreign objects. So for those, actually, they're some of my favorite cases. For septic pedal osteitis, so that infected coffin bone, in the human world, from my understanding, is they just cut off the digit. But we thankfully don't do that. So we have to be a little bit more aggressive. Traditional way to do it is to go in there and debride the bone. So go in there with some curettes, and it's a little bit of a search and destroy mission, where you just kind of scrape away all the dead infected tissue until you have nice, clean, healthy tissue, and then treat it with some antibiotics. What I see most veterinarians doing is using a combination of systemic and regional antibiotics to treat this. And they're using some pretty heavy antibiotics, because a lot of these horses do have some vascular compromise in that region when they get some of these infections. But since we're dealing with such big issues with antibiotic resistance, we're really trying to minimize our usage. So I've been using a lot of medical maggots to clean it up. So I can use a little bit of antibiotics, but there's a species of maggots that only eats dead and infected tissue, and we'll go ahead and put them into the wound. And usually over the course of 7 to 10 days, they'll go ahead and debride just the dead and infected tissue. And the horse usually does much better that way, as long as the lesion's small enough.
Yeah, I've seen that done. I've never done it myself, but it's been so cool to see how that works. And it's obviously in my mind, it's sort of counterintuitive. I mean, it makes sense, but when I think of maggots, I think of, they're in something gross and nasty and dying. So it's really cool that they have that option for ones that only go after the necrotic tissue.
Yeah, it's one of my favorite things to send the horse home to the owner, and they saw me put in these just little tiny specks, and they open up the treatment plate, and then these full-size maggots fall out on them, and I usually get a bit of a panic phone call, but it's a small joys in life for me.
Yeah. So they can stay at their barn. They don't have to be in the hospital for that.
Yeah, depending on the owner, but if owners are comfortable with doing the bandage changes, I'm pretty lucky. I can do most things in the field related to these processes.
That's great. And this is kind of like an maybe different question, but do you see chronic abscesses that correlate to a horse with metabolic conditions? Is that something that you see as a risk factor?
We definitely do, and I kind of throw that into our laminitic category. We see a lot of horses with chronic laminitis / metabolic disorders that they seem to be chronically abscessing. And we struggle in a lot of these horses to get their metabolic status under control. There's also a lot of information in the metabolic world that we don't fully understand yet, especially when it comes to testing for it. And then some of these horses, no matter how we change their diet and how we manage them medically, we still can't get their insulin under control. So a lot of those horses, we do run into some chronic abscessing. I think kind of the most effective thing has been being pretty aggressive with our shoeing to hopefully keep vascular supply to the foot so we don't get these abscesses, and also protect it from the ground forces that might be causing bruising in these abscesses and all that stretched lamina from getting filled with mud and debris.
Yeah. And so actually, I'm just looking at some of I guess another question I had is if you have a horse that has a really bad abscess that turns into, a bone infection, I guess I should back up. Is there a way to prevent an abscess from turning into a more sinister infection?
Yeah. So, aftercare is for everything, especially foot related, is really important. The foot's down in the dirt. So keeping things clean is really important. So I personally, when a horse has an abscess, if your farrier is skilled at opening and draining abscesses and feels comfortable with that, for me, the point over it needs to become the vet involved is if we haven't opened it up in about 3 days, or if we're getting to the point where there's blood. But before that, most farriers that have experience opening abscesses can open up the vast majority of abscesses. But afterwards, what do? We now have this hole in the foot, bigger or smaller, depending if the farrier opened it up or the veterinarian that got excited with their hoof knife decided to open it up. So, I usually traditionally wrap them and soak the foot until the drainage is gone. And then depending on location, the environment, a lot of times I'll put a shoe on these horses to prevent mud and debris from being packed up in there and causing the abscess to recur. Because this is something we didn't say, but that's the number one reason why we see recurrence in abscesses is a old track that gets repacked with mud and debris and an abscess recurs.
Do you have a typical timeline for how long until you're confident that those, tracks are fairly safe to expose, or is it just once it's grown out?
That's a tough question. We have a lot of abscesses that blow out the coronary band. And if they blow out the coronary band, it's a full year till they're completely grown out. And I honestly don't keep horses in shoes for a full year. Depending on its size, a lot of times I put a shoe on for a cycle or two until the majority of the defect is grown out. The ones that really undermine the sole and we have this large defect that occurs, sometimes they're in a shoe for a little bit longer than that. And then a lot of horses, honestly, I open up an abscess on and I go ahead and I pack the abscess track a week or two later with some antiseptic and then a wax of some sort to seal it up, and the horse doesn't look back. But as a whole, those ones we need to make sure they're nice and dry and that there's no residual infection before we seal them back up again.
And when you were talking about using the medical maggots, is that just needed for I think you mentioned 10 days. Is that just needed that like one cycle, quote unquote, or do you have to do another round of them after that?
For the vast majority, it's just one cycle. I've had a few that have had some significant soft tissue infections and or really bad post-surgical cases that I've had to do multiple rounds on, or actually the ones that we really see a lot is our chronic laminitic horses that have infected coffin bones that have uncontrolled metabolic status. Those ones we often need multiple rounds, but the vast majority we just do one round. Unless the defect is really big, those horses I do usually put a shoe and treatment plate on beforehand just to give the little critters a little bit of protection while they're in there.
Awesome. All right. We've kind of like exhausted the questions that I had. Is there anything that you feel like is important that maybe we didn't cover?
I guess my biggest thing is when you're getting to the point where you're suspicious, it does not hurt to get an x-ray. I know that there's a cost to the client, but I've had a lot of cases where we've been dealing with chronic abscesses for weeks before the veterinarian gets involved. And at that point in time, we have a sequestrum or something much, much worse. And I know that's the off case, but if we're struggling with an abscess and we don't see good progress quickly, whether it's lameness improving or drainage decreasing, it doesn't hurt to get an x-ray and then there's not something bigger going on in there.
Yeah, that makes sense. You did an awesome job. This was incredibly comprehensive. And you have really great way of answering the questions to make it really easy to understand for the differences in audience. Thank you so much for being able to explain things and being willing to do this on a few days before Christmas.
No, it worked out well. So
yeah.
Perfect. Yeah. And if you need help with anything in the future, let me know.
All right.
Thanks.
Thank you so much. Have a great rest of your day.
You too. Thanks.
Bye.
Bye.
I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.